Welcome to the Deep Dive. Today we're looking into a really fascinating area where art meets science.
Yeah, it's cosmetic and medical tattooing.
Exactly. It transforms lives, can redefine beauty standards. It's quite something. We've got some great sources today, articles on trends, but also detailed info from a real leader in the field.
And our mission, I think, is to really unpack this. It's not just about looking good, though that's part of it. It's about, confidence, natural illusions.
Restoring things.
Precisely. From subtle enhancements like you might think of with makeup, right through to quite significant reconstructive work.
So we want to give you a clear picture. What services are there? Who are they for? And importantly, what should you look for if you're considering this? Let's dive in.
Okay.
Let's start with, a pretty big shift in how we think about beauty. Our sources point out, not that long ago, the ideal was often total coverage.
Right, like the Elizabeth Arden flawless finish.
Yeah.
Almost grease paint, as it was described.
Yeah, covering up everything, freckles, skin texture, you name it. The goal was uniformity, a blank canvas.
It really reflects a historical view, doesn't it?
Mm-hmm.
Imperfections were something to be hidden. Uniformity was prized.
But things have swung, dramatically. Think about the last few years even. From heavy contouring to now.
The clean girl aesthetic.
Exactly. Dewy, glowing skin, minimal makeup. Skincare is huge now. You see celebrities like Meghan Markle, Zoe Kravitz really celebrating their natural features.
Which includes things like freckles.
Definitely. Freckles are having a moment.
Which brings us to this kind of ironic twist, right? What happens when something natural that maybe people used to cover up becomes so desirable?
The people actually pay to get them.
Precisely. The rise of freckle tattoos. It's fascinating.
It really is. People are getting freckles tattooed on. We have this story from Alex Borrett, a dog groomer. Got them for her 31st birthday.
And what did she say about them?
She loves them. Says she just needs mascara now, no foundation, skips that whole masking step. And she mentioned, unlike her other tattoos, these were meant to look like they were always there, just, part of her.
And that's the absolute core of cosmetic tattooing. It's not meant to shout tattoo.
No.
It's about illusion. Dasha, a specialist we looked at, she put it perfectly.
Yeah.
The goal is to make an illusion like it's natural.
Enhancing what's there or restoring what isn't, but making it look completely authentic.
Exactly.
Mikhail Leonek started offering freckle tattoos way back in 2011, apparently, but says demand just exploded around 2022. It ties right into that clean aesthetic trend.
And it's not just young women, though they are the main clients.
No. She mentions a man in his 60s getting them recently. Just wanted to look, quote, more youthful.
It shows the broad appeal, I think. Feeling good in your skin.
Mm-hmm.
And the process itself for freckles. Our sources say it's surprisingly manageable.
Yeah, Alex rated the pain like a 2 out of 10, said she even nodded off during the session.
Wow, that tells you something about the technique. It's delicate, it's semi-permanent. Very different from, say, a traditional body tattoo.
And that semi-permanent aspect is key, isn't it? They don't peel like a normal tattoo.
No, not in the same way.
They look prominent at first. Alex said she felt like people were staring initially, but they settle down fast, and they fade over time.
Right. The longevity depends a lot on skin type and aftercare. 2 to 3 years for normal or dry skin if you use sunscreen diligently.
Which Alex did. Hers looked great after 18 months.
But maybe only 6 to 12 months for oilier skin, or if you skip the SPF. So aftercare is crucial.
And she plans to get them redone, so it's a commitment, but not a forever one.
And it's vital to stress, these aren't done by traditional tattoo artists. You need a trained beautician, often someone with a deeper understanding of skin and facial aesthetics. And the environment has to be sterile, medical grade clean.
Absolutely. Okay, so freckles are kind of a fun, trendy entry point, but this field is so much broader.
Oh, hugely. We're moving into areas with really profound impact now.
Beyond the cosmetic things people might already know, like eyebrow tattoos, eyeliner, lips.
Yeah, those are popular enhancing natural features.
Okay.
But the medical applications, that's where you see truly life-changing work.
Our sources detail quite a range. Things like scalp micropigmentation, SMP. Yes, SMP. Yeah. That's huge for hair loss. It creates the illusion of density, like tiny hair follicles. A real confidence booster for many men and women.
And skin camouflage. For stars, or maybe skin conditions.
Exactly. Blending things in, minimizing their appearance. And then there's inkless scar and stretch mark revision, using techniques that stimulate the body's own healing to improve texture and color, often without adding pigment.
That sounds quite advanced.
It is. And often this kind of work, especially post-surgery scarring, involves collaboration. working with plastic surgeons, for instance, to get the best possible outcome for the patient. It's part of a whole healing journey.
And then there's areolar repigmentation. That sounds incredibly important.
It truly is, particularly for post-mastectomy clients. Experts in this field often work closely with organizations like the Breast Cancer Society. It's about restoring a sense of wholeness, you know? It goes way beyond just the physical appearance. It's deeply psychological.
Wow. The range keeps going. Belly button reconstruction tattoo, nail reconstruction, even things you might not think of, like tattooing for syndactylly webbed toes to create a visual separation, or dark circles camouflage.
And importantly, removal too, if someone has old work they're unhappy with.
Yes, offering safe cosmetic tattoo removal is crucial. It provides a complete cycle of care.
And the setting for all this, it sounds like it needs to be more than just clean.
Absolutely. The sources talk about a boutique clinic feel, comfortable, inviting, but underpinned by rigorous medical-grade standards. It has to be a safe space, both physically and emotionally, especially for medical tattooing clients, a place that feels, healing.
Right. Let's maybe focus on one service to see the detail involved. How about lips? Lip tattoos.
Okay, good choice. There's a lot of artistry there. You've got different types. Lip blush is very popular now. It gives a soft, sheer wash of color, like a natural tint, just a bitten look.
As opposed to
a solid color fill, which is bolder, more like wearing lipstick permanently. Or just a lip outline, which defines the border, maybe if it's faded with age.
And I saw something about dark lip neutralization.
Yes, that's a really specialized technique. For people with naturally darker or hyperpigmented lips, maybe due to genetics, sun, medication, the process aims to lighten and even out the tone first, before applying the target color. It takes skill and understanding of color theory.
So it can create a more uniform, perhaps lighter base.
Exactly. Or for lips with uneven color, maybe white spots or scars, tattooing can camouflage those and give a really nice, even, natural tint.
And the pigments, they must be specialized too.
Oh, absolutely critical. Certified, FDA-approved, medical-grade pigments. Often European standards are cited. Safety first, always. And they offer different longevities, right? Some shorter term, 6 to 12 months, others lasting 1 to 5 years.
So you choose based on how long you want the effect. And color choice must be key for that natural illusion.
Totally. You can go just a shade deeper than your natural lip for subtlety, or choose brighter pinks, reds, berries for more impact. But the artist works only on the lip tissue itself.
Never onto the surrounding skin.
No. You can create an illusion of fullness with a defined border, especially if the natural edge has lost definition, but for actual volume.
You need fillers for that.
Yes. Fillers add volume, tattooing adds color and definition. They work on different layers. You can do fillers 2 weeks before or after tattooing, generally.
Okay, good to know. Now, the bit everyone probably wonders about, healing. What's that like for lips?
It's a process, definitely. Immediately after, expect swelling. Could be minor, could last up to 30 hours or so, and the color looks very bright, very intense.
Brighter than the final result.
Oh yes, maybe even 10% brighter on day 2. Then around day 3, things start to feel dry, maybe a bit of peeling or flaking.
Okay.
That usually finishes by day 4. A special ointment helps manage this. By day 5, the initial intensity is gone, and the color looks much softer, more natural.
So that bright phase is pretty short.
Relatively, yes. Then over the next couple of weeks, the pigment settles deeper. Color might fade slightly if the skin fully heals over it. You get a good sense of the result around 4 or 5 weeks.
But the truly final, stable color takes longer.
Usually around 3 months, often after a second touch-up session. That's when the pigment has fully stabilized in the skin.
And aftercare sounds quite specific. Wiping, cleansing, ointment.
Yes, it's personalized, but generally involves keeping the area clean, removing any fluid initially, gentle cleansing, and crucial moisturizing with the provided ointment, especially during the peeling phase. And sometimes, simple lip exercises are recommended to help manage swelling initially.
Lip closure, puffing cheeks. Interesting.
Little movements to gently encourage fluid drainage.
Right. It's clear this takes incredible skill and, ongoing learning.
Absolutely. The sources really emphasize the commitment to education, not just teaching clients, but continuously learning yourself.
The expert mentioned is described as a speaker, even a judge at international conferences. BLPMU, bold and beautiful in New Zealand.
That signals a real dedication to staying at the forefront, doesn't it? Sharing knowledge, but also absorbing the latest techniques from around the world.
Traveling, learning, bringing the best back for clients. That seems to be the ethos.
And also training others, offering courses for aspiring artists. It shows a passion for elevating the entire industry.
It speaks volumes about the dedication needed in this field.
Definitely. It's this deep passion for knowledge, and importantly, its careful application. That's vital. Believing that knowledge is only truly valuable when it's understood and used effectively, safely.
So quite a journey we've taken today. From, tattooed freckles capturing a trend,
all the way to profound reconstructive work, like areola repigmentation or scalp micropigmentation.
It really underscores that this field is so much more than just aesthetics. It's about empowerment.
It really is. Restoring confidence, creating that natural illusion that aligns with how someone feels inside. It's this blend of meticulous artistry, safety protocols, the medical grade settings, the certified pigments, and that constant drive for better techniques.
Finding that balance between art and science for results that can be genuinely life-changing, it kind of makes you rethink beauty standards again, doesn't it? From covering up to skillfully adding or restoring.
Which leaves us with a thought, perhaps. In a world that seems to value natural more and more, how will these highly specialized tattooing services keep evolving? How will they continue to meet our diverse needs and maybe reshape what natural can mean for each of us?
Something to definitely think about.